Dr. Macarelli. Hello. Hi, Stilicious. Hi, Udoni. Hello, Vanessa. Hello, my dear. Vanessa Nguyen. Hey, Liz Peral. Carolyn. Oh my gosh, lots of people. Sarah, Elizabeth. Let's see who's on my Facebook Live here. Okay, nobody. Okay, there you go. We got 4. So say hi. Hello. Nice to see everybody. Cowgirl light. That was my guess. Oh, I got kisses. I love kisses. Everybody knows that. Hi, Thickums. Hello. Hey, Akira, Kristen Pullen. Hello again. Melissa, you guys are jumping on. Jamie, Elizabeth, Jessica, Corbin. T.S. De La Rosa. How was my weekend, B Noble Jack? My weekend was fabulous. I had a great weekend. Worked Saturday, but did I keto Saturday and Sunday? Getting ready for my exam. It's all good. My next belt. Hey, Jamie. Hey, Katie. Hey, Darina. Hey, Andrea. Hey, Catrice. Katamaravi. Nice to see you. Natural Tay. Stella Licious. You're back again. Ashram. Natural. Gisela. Hello, Gisela. And hey, Kayla. Catrice. So today, hi, Stephanie. Stephange, I guess is a better word. L. Young, good to see you. L. Young, 1781. Nefertiti Queen, sorry about that. Sir Toby the Corgi. Oh, sorry, Sir Toby the Corgi, that's cute. Okay, I finally made it. Christy O'Neill, thank you, glad you're here. Aaron, I have an HHD test Thursday and got no beforehand things to do. What should I expect them to do? Prepare. Okay, let's get some questions in. Okay, so hysterosalpingogram is an X-ray. Nothing to prepare for it. Basically, they'll get a little bit of pee, make sure your pregnancy test is negative. Then you go into essentially the pelvic position. They'll wash the cervix. They'll place a small little tube inside. None of this hurts. Inside the uterus, they'll instill some HSG dye, and then we'll take some x-rays, and that'll tell us whether the uterus is normal. It'll tell us whether the fallopian tube is open, and it's pretty darn good. It's about 75% good. And another test is called the hysterosonogram, where we actually put fluid, like saline fluid, inside the uterus, and then we use an ultrasound instead of an x-ray, but it doesn't tell us the tube. The gold standard is called diagnostic hysteroscopy, where we actually look inside to see whether or not there's anything in there with the human eye. And so really not much to do. Just there's going to be some antibiotics to take. Don't have a gigantic meal because it's, but yeah, just, it's not fasting. Okay. Was there an 8 out of 10 now pregnant? Okay, the staff are amazing. Well, thank you, Amanda. Kate, wondering about Lupron for endometrial receptivity assay. Is it needed or only? Oh, I lost that one. Let me see if I can go down. No, I can't. Okay, righty. Let's see this. Everybody's throwing stuff at me. Doing HCG wash and Neupogen wash both 24 hours before transfer day. Would the fluids have time to absorb? Absolutely. What do I think about embryos 4 cc day 6, 3 cc day 7? I think they're your embryos, therefore they're perfect. What size do follicles need to be triggered? Mine were only 15 millimeters on Monday. You want to get them to about 18 millimeters minimum. I'm 4 weeks, 6 days pregnant. I'm assuming a progesterone drop, PiO2 Dhea. Nope, don't have to add anything. You're 4 weeks, 6 days. Now that probably means it's your first test, right? Anyway, are you doing the vaginal and endometrium? Oh, no, gosh. No, don't add any more. Is there any way to up your chances of getting a boy embryo? No, except for PGTA, where you can pretty much 99.9% get a boy embryo. Egg retrieval tomorrow of my one and only follicle. You know what, Kelly Lamb? 1 egg, 1 embryo, 1 baby. That's my philosophy, and I live by that philosophy. What can I do to prepare before I begin my IVF journey? Very simply, go download our family building guide and read it and do it. Acupuncture, Serovital, which you can pick up at Costco. Avoid alcohol, tobacco, drugs, both male and female. PCOS, low carb eating. Myo-inositol or inositol or avasitol. Jessica, how does fertility meds affect the liver? Higher range of normal liver enzymes. Ultrasound is scheduled. Need to know if I need to hold off until the next cycle. Well, Jessica, I don't think that the fertility medicines are causing any changes in your liver, so you may want to hold off until you get that sorted out. Why do you live by 1 egg, 1 embryo? And that's because the very first treatment I've ever done when I was a private doc was a woman had 1 egg, 1 embryo, and 1 baby, so I know it can work. I cannot find Serovital at Costco. Yes, oh my God, you can get it online from the company, Serovital directly. Well, how many IUIs do you recommend before going to IVF? Well, typically you do 3 IUIs and then you have a consult, and it depends on your age. Okay. If you have mushy eggs for an ER, does that egg retrieval, does that mean all your eggs for future ERs will be mushy? You know, Liz, I don't know even what that means. I'm sorry. 41 with 2 failed IVF cycles, are IUI worth doing? Well, whether something is worth doing really has to do with how you feel about it. If it's less than 1% chance with an IUI, what does smooth endoplasmic reticulum an indication of? I don't know I don't think smooth endoplasmic reticulum is something I'm familiar with in terms of embryology. What can be done for adenomyosis? I have a whole talk about that. Go to CNY Fertility. All the talks are recorded. I did a whole talk on adenomyosis. It's all there. Can any of the IVF medications affect your blood pressure? Nope. Not really. Lowers the blood pressure a little bit. The progesterone does. I read a new study about metformin to treat inflammation for endometriosis patients. What are my thoughts? Well, what it's really saying, it's not metformin. It's just that they don't want to tell you to cut out the carbs. So you find a drug that cuts out the carbs for you. It's a cheap, easy way to get there. The best way to do it is just cut out the carbs, and that's what metformin does for your body. Do you do ovarian rejuvenation? What we do is PRP of the ovary, which people call ovarian rejuvenation. It is basically adding growth factors. We do it of the uterus. We use Serovital and growth hormone. We use acupuncture. All of these things are meant to increase what's called neovascularization, improve growth factors, and that's what causes sort of rejuvenation. It's a cutesy term. What does it mean if your day 5 blast is 0 p.m.? No, it can't be. That term will confuse Alyssa. That's usually no pronuclei, and that's on day 1, never on day 5. It just means it didn't grow. I've always heard endometriosis can cause infertility, yes, but it can cause miscarriage as well, or for IVF, will it be less successful? Well, it may be less successful. It may be basically because of the inflammatory components in there. When is the best to get an HSG done? After retrieval or before first consultation? Before first consultation. First medicated time, intercourse cycle through COI, I think it failed, but not giving up hope. Of course not, my dear. It takes on average 6 IUIs to make a baby, typically. Oh my God, I'm holding my 2-week-old baby. Oh my God. Yay, Leah, congratulations. Last I told you, 41 years old, AMH was 2.57 embryos, day 5, all abnormal. What should I do for the next cycle? Well, again, growth hormone, Serovital, acupuncture. There's not a lot we can do to change the aneuploid rate, but again, getting access to more eggs is probably a good idea. How to increase my chance of ovulation? I have PCOS. Well, you can get triggered, Ashley. We can give you a medicine to make you ovulate. Hello, everybody. How many embryos, do I usually transfer? Well, embryos, 1 is our usual number. Progesterone greater than 40 day of transfer, and E2 is 3. Is that okay? Yes, that's great. First time, no eggs. Second time, 8 eggs with 30-day prime. That's prime with Human growth hormone, serovital acupuncture. Should I prime for 90 days for more eggs? No, Mandy, because every month, I'm guessing you're over 35 because you only got 8 eggs. I may be wrong. But typically you lose 10,000 eggs every month. So to wait 90 days, you've lost 30,000 eggs. Not a good plan. Just keep going. You've already primed, keep priming, but get on to the very next cycle. Ovarian PRP, how is it performed? Basically, we give you anesthetic, place a needle through the wall of the vagina, much like an IVF, where we take the eggs out. This time we put fluid into the ovary. Have there been babies born from 4cc embryos? Absolutely. All righty. Yeah. How long after removing a fibroid can you start IUI or IVF? I say 6 weeks. I'm 36 and have both tubes out from hydrosalpinx. Could I still have success? Absolutely. You don't need your fallopian tubes to be successful at IVF. Ariana, hi. If I come to Colorado, will you do my egg retrieval? I'll try. You can ask for me, but Dr. Fink and I, depending on our schedule, okay? But yeah, just ask. What does high-level mosaic embryos mean, Happy Nagra? Well, it means they're not normal and that there's a mixture of normal and abnormal cells in the biopsy with more abnormal cells than normal cells. What we now know, in the past we would say you can't transfer those because they're abnormal, but now we feel like if you have no other embryos and it's your only choice, you can, but you have to realize that there's a much less chance of implantation, much higher chance of miscarriage, and of course a chance that your baby will be born with chromosomal abnormalities. Why would my guy's first semen analysis come back with no sperm, and then minutes later when they had him do it again, it came back with plenty? What could cause that? He didn't ejaculate or he missed the cup. Do you need a trigger shot if you ovulate on your own? I recommend it for timing. I just found out I'm pregnant. What are your thoughts of the vaccine first trimester with Hashimoto's? I think the American College of OBGYN says it is much more safe to be vaccinated than to be not vaccinated when you're pregnant, breastfeeding, etc. Lacey, I had a surprise pregnancy. Congratulations. Does elevated DHEA prevent you from a successful IVF? Well, it can interfere. So what I do recommend is you ask them to put you on like dexamethasone, which can lower your androgens in your body, okay? I've had 2 transfers of 3 embryos, both failed. How did you get 3 embryos? Could my endometriosis be the cause? Yes, it can. Hi, Ann Trimble. Hi. Is there any special protocol you would recommend for someone with kidney damage before IVF process? Kidney damage, not that I can think of. Not that you just don't want to get hyperstimulated. So you want to kind of have a low dose protocol, like a mini. Mini would be very good in that circumstance. I'm taking it easy per your instructions. I feel hopeful we were successful. Me too, Ann. Say a prayer. I read inositol was recommended for PCOS, but I also read it is not insulin. If not insulin resistant type, it would only make you worse. Is this true? One doctor told me not to take it because I'm not insulin resistant. Another told me to take it because there is no harm. So who do I listen to? Laugh out loud. Estefani, every doctor is like a chef. Everybody has an opinion. You may not need to take DHEA. It's not critical. It's a small adjunct. They're usually bigger issues. If it's confusing, don't do it. I've had 2 failed transfers back to back. Should I take time before another one? Yes. But also you might want to do an endometrial, this is Nalevi Palma. You might want to do a endometrial receptivity assay. Happy, how do I increase my chances for a normal embryo after getting all abnormal? I think I answered that. Growth hormones, serovital, acupuncture, avoiding alcohol, tobacco, drugs. But in reality, you really can't make a normal egg. Estefania, you're welcome. Posted too quick. I had a surprise pregnancy 8 years ago. Now we've been trying for a year and had 2 miscarriages. Lots of problems there. Get the basic workup. I've heard and read that vaccine is causing miscarriage and sterilization. It is absolutely untrue. I love the whole concept of CNY, but I'm struggling with the lack of detailed communication, personalized treatment. Well, then you're not reading our family building guide. You're not listening to our Facebook lives. You're not using the portal. Yeah, I'm a little concerned that you're concerned because honestly, there are so many ways to communicate. For example, you're communicating now with the doctor for an hour, and we have 8 of them a week. We have people will answer your portal messages. Now, we do have 8,000 phone calls a day. So yeah, you're going to take 2 hours to get on the phone, but the portal, we watch that every day. I'm 15 DP, 6 DT. Are 6-day embryos less likely to make it to term? I have no idea. I have no idea what that means, Shannon. Oh my God. Yes, and I love you guys. It's more with the nurses. Well, you got to realize they're the ones who take the brunt. This is Labelza of our calls and tasks. And I will tell you, I've gone from 8 staff members to 40 in less than a year just to handle the volume. Oh my God, Kelly, congratulations. Oh my God, that is so wonderful. Congratulations on your pregnancy. 8 weeks, 4 days. Yay. Be kind to the nurses. That's the announcement from Elizabeth, because honestly, they're the ones working their butts off. I got to tell you. Okay, Becca 80. Failed day 3 transfer last Monday. What are your thoughts on fresh day 5 since I had success with my first IVF with day 5? Increased menopause suggestions. You know, Becca 80, I can't answer. That's too much information. Just set up a short consult. Is it okay to take the vaccine before or during the IVF process? We tend to want you to wait during the IVF actual process. It's much better to take it before. Aunt Leah, I'm 40 and I've been starting IVF in Colorado in September, AMH and only 4 follicles. Should I do several egg retrievals in a row and try to get yes before transferring? Yes, always bank your embryos before you do a transfer. When I start, Ellen, when I start IVF with CNY, how do I choose which is the best company to order my meds from? Do you have a list of recommendations? Well, go with the cheapest because all the medicines are the same. So look at we typically use Fertility Pharmacy of America. We use MDR. We use, there's a lot we use. So as long as you get a good price, they're the same meds. Have you seen a successful pregnancy with a lining of 6? Absolutely, that's what the data says, 6 and above. My mushy eggs were the membranes of each egg. Embryologist said we're doing ICSI. The egg members were mushy. What that means, they will be mushy going forward. You know, it could mean that, Liz. It just means it was soft. It was trying to explain why he didn't feel that those eggs were top notch. But it doesn't matter. If it fertilizes and it grows, it fertilizes and it grows. When do you implant embryos after a mid-luteal stim? Well, after 6 days after your retrieval or 3 days after your retrieval. I'm 41 and 2 embryos look great. Integrity RX is the best, and they give a coupon. There you go. I have unexplained fertility. 41 embryos look great. We only had 2. 41 embryos look great. We had 2. Did not implant in Buffalo. So lots of things to do. Rochelle, talk to one of the docs and review your cycle, growth hormone, serovital, acupuncture, low carb eating. Those are the keys. If you transfer 2 at a time, can they make each other fail to implant? There's some suggestion that that's so, but not very strong. And there's Vanessa about our support group, guys. Definitely support the support group. Donor retrieval is Thursday. Last ejaculation was Saturday. Was told to still up staying until Thursday morning. Do you agree? Not 100% sure what that means. How many grams of carbs per day do you recommend? The 50 grams or less. The recommendation for a low carb, moderate protein, high fat is about 50 grams of carbs a day. Most of the carbs coming from green and crunchy vegetables, not from grains, not from sugars, of course, not from there. The global team is not responding. They want me to lap hist and my husband. I don't know. Can you transfer 2 eggs for a woman over 35? Well, we're talking embryos. If they're untested, likely yes. If they're untested. If they're tested, it's likely 1. Have you seen a successful pregnancy with spontaneous IVF? Absolutely. Approximately how long after cycle day 1 is a frozen transfer? 18 or 19 days. I'm 42, was told I have PCOS. Never heard this before. I had a baby naturally 7 years ago. How do I know if I have PCOS or not? Currently, they have me on birth control. Well, you could do blood tests, you could do an ultrasound, or you simply can watch your behavior. So those are 3 main ways of doing that. Blood tests being the easiest, of course, looking at the androgens. This may sound silly, but can someone who went through menopause carry a baby as a surrogate if put on hormones? Naliva, not at all. That's not silly. The oldest woman to carry it was 74 years old. So, and they had, of course, got to give her hormones because she'd been in menopause for 30 years. I have a consult next week, has 3 healthy daughters, youngest is 5, I'm 43. Any words of encouragement? Yes, get to your consult and be prepared to state very clearly what you want to do, because you can't waste any time. Make sure you've already had, go to the family building guide. There's a list of the pre-tests everybody should take. Please get all those pre-tests from your doctor before, because that'll save you time to jump into a cycle. Infertile, not able to get an earlier appointment. I don't know what that means. How much does transferring 2 embryos increase pregnancy chance of untested? It's probably about a 10% increase in pregnancy, but probably 100% increase or more in twins, triplets, quadruplets, quintuplets, octuplets. I've certainly transferred 1 embryo and gotten 3 babies, 2 and gotten 4 or 6 or 8 babies. Not a good plan. When will a day 3 embryo typically implant? All embryos implant on days 7 or 8 or 9. That's when they all implant. Olivia, out of 30 eggs retrieved, 15 were mature. Only? That's a lot. If I do another retrieval, are there any tips to make them grow at a more even rate? Sorry, Olivia, that's a good cycle. See you tomorrow, Camille. All right. I'll see you in the morning. Eek! So yeah, come say hi or say, hey, I want to talk to Dr. Magarelli and tell him, because I talked to him on live last night. What are my thoughts on genetic testing for older women over 35 to 40? Excellent idea. Over 40, not so useful. Under 35, not so useful, but 35 to 40, good use. Would you recommend an oophoropexy for recurrent ovarian torsion before starting stims, or does it make egg retrieval too difficult? It probably won't, Sarah, affect the egg retrieval, but I would talk to your person who's doing the egg retrieval. My doctor is recommending a laparoscopy. My first consult is October. Can COI order the HSG hysteroscopy and laparoscopy beforehand? Alan, contact our office. I don't know the answer to that. Did IVF cycle twice? HSG was done last year. Do I need to repeat in January? January 2020? Yeah, this is not as long as it's within a year. Do you recommend testing the embryos with low AMH and FSH of 12? Maria, the AMH and FSH are just indicating low ovarian reserve, which some suggest, if it's really low, may be associated with higher number of abnormals, but I don't use that as a measure of doing the genetic testing, so not really. I was informed I can do a fresh transfer the next of my egg cycle. I don't know what that means. Is there anything you could do to prevent ovarian hyperstimulation? Acupuncture, protein, electrolytes, rest, lower dose medications, only a Lupron trigger. These are things you can do. Can PCOS affect egg quality? Not really. Maria, my AMH is 0.43. There must have been a question with that. Sorry. Why have male factor infertility secondary azoospermia from varicose? Is it possible to have biological babies through IVF? This is KTS Joy. Yeah. Because you can get the sperm directly from the testicles, called the tesa, pesa, mesa. And then they could take that sperm and fertilize the eggs that are retrieved through IVF. Cramping after transfer, is it normal? What can you do? Well, increase your fluids, Stella Alicia 79. Increase your fluids, bed rest, and acupuncture. What do you recommend if you didn't have any eggs first cycle? I want to make sure it's, well, this is Tara Van Tassel. Well, make sure you're doing growth hormone. You may even want to do PRP of the ovaries. You may want to do serovital. You may want to do acupuncture. I have a lot of weight to lose, but I need to start egg retrievals as soon as possible due to age. Can I do medically supervised optifast while taking IVF medications and doing egg retrievals? Probably, as long as it's a balanced food, probably. Any recommendations for low sperm count, low motility, and low zero morphology? Get to a urologist, Gisela. Get your husband to a urologist, because that they should, you want to check him out first. And then, of course, IVF with ICSI and TISA. I had 3 miscarriages in a row. My recurrent fertility is suggesting to test my embryos because I have low AMH. Just wondering if I should. Well, you certainly can. Maria, I don't remember how old you were, but yeah, you certainly can. Do you have any ideas for those who have pure unexplained secondary infertility, 3 failed IUIs? IVF, absolutely IVF. After a day 3 FAT, on what day would you do a urinary pregnancy test? I like it 2 weeks after your transfer. Some people yell at me, but oh yeah, yeah, you're perfect age, Maria, to do PGT. So that 35 to 40 benefit the most. And Dawn Maria, it's, you know, it's approximately 2 weeks after you do the embryo transfer, but it could be as soon as 12 days. What are your thoughts on still abstaining 2 to 5 days? Hubby ejaculated Saturday and retrieval is Thursday. Yeah, 2 to 5 days is fine. And if he doesn't have a bad semen analysis, I'm sorry. Yeah, if he doesn't have a bad semen analysis, you can go 6 days. But yeah, you want to, if he doesn't have a super low count, then 2 to 3 to 4 days is fine. I was told today that I should do a frozen transfer today just because they got 17 eggs. They said my levels look great, but letrozole could block my actual E2. Would it be risky to do a fresh transfer? Yes, Casey. The problem with letrozole is it masks the estrogen level, which is what we use to figure out if you're hyperstimming. Well, if you mask it, then your body has to tell us. So they looked at your body and probably got fluid, ovaries real big. That's ovarian hyperstimulation, whether the estrogen is there or not. Would you consider doing an ERA before someone's first transfer? Sure, especially if you're doing genetic testing on the embryos. How to increase the sperm count and motility a year after vasectomy reversal? Well, Candace, here's the problem. The big issue with vasectomy reversal is not the numbers, it's the anti-sperm antibodies. And as a reproductive endocrinologist, I know that if you're dealing with sex, trying to get pregnant with sex, Clomid can help in some cases, but not all times. Does PGTA affect the viability of embryos? Absolutely. Anytime you touch something, there's an effect. Now, is it a big effect? Not likely, because we do millions of them. What should be the right progesterone and estrogen level? I don't have one. People like it to progesterone over 20, but estrogen, I don't have a number, because there is no number that's the right number. Would you recommend priming for retrieval for a patient with repeated implantation failure? Yes. Can PGS embryos still be poor quality and possibly improve with priming? Hypothetically, yes. Does low egg reserve really cause recurrent miscarriage? Yes. What's the difference between docosahexaenoic acid and icosapentaenoic acid when it comes to fertility? I'm struggling to find omega fish oil with higher DHA than EPA. Please don't struggle, Andrea. Any fish oil, high quality is fine. I'm taking CoQ10, vitamin D, zinc, prenatals, folic acid. I want to add DHA and geritol. Is that too much? Why? I don't know why you want to do that. What's the best advice you can give to someone struggling with infertility? Charlie in charge. Well, get to testing as soon as possible. Understand that the male is 60% of the reason why people are infertile. So make sure his lifestyle is right. Avoid alcohol, tobacco, and drugs. But get to a reproductive endocrinologist as soon as possible. Is there a natural supplement to help with the morphology? Or morphology unique, D, is a genetic thing. So no, there's no supplement. What is the protocol for having natural killer cells? I don't know, Dexter. What are the chances of success with IVF if you fail 3 IUI cycles with a trigger shot? They're not related to each other. Does sperm morphology affect fertilization in the lab? No. We do select the best sperm, Deanna, for injection. What do I think about Omnitrope? Dula, Carolina. I really like using Omnitrope way more than I do. And I like using a natural form, which is Serovital, of revitalizing your own growth hormone. Is NAC recommended for PCOS patients? Although my hormone levels are fine, ultrasound indicates mild endometriosis. N-acetylcysteine, yes, has been recommended, and there are studies to support that. Is 2 weeks of Lupron recommended before egg retrieval for a patient with low AMH? They're not associated, Deanna. I had Jalen. I had my consultation on Monday. I have recurrent pregnancy loss, 3 miscarriages in the span of 8 months. Sorry. I'm only 22, so time isn't an issue for me. Would you recommend jumping into a cycle or trying to get the root of the problem? Root of the problem first at 22. What should TSH be for FET 2.0 or less? My husband is 39 and I'm 37. Are we too old for InvoCell? I didn't know there's an age limit. Sorry. I don't think that your age relates to the use of InvoCell. I don't. Plus, on HMG only cycle with Lupron and HCG triggered. They work. Yeah, they work. It's a gonadotropin. All the gonadotropins are gonadotropins. They're the same. Some are pure, some are mixed, some are recurrent recombinant genetics. Some are natural sources, but they're all the same thing. They're FSH or FSH plus LH. Yeah. What's the difference between a day 3 embryo or day 5 embryo transfer? Well, the only difference is that by getting them to day 5, you know much better whether they'll still survive, and also you'll know much better whether they'll implant. I have diminished ovarian reserve and I've done 2 IVF cycles. What's my next option? A 3rd IVF cycle. Even 20-year-olds, Anita, take 3 IVF cycles to make a baby, and they don't have diminished ovarian reserve. Can transfer and polyp removal be done at the same time? Absolutely not. Just had miscarriage in May. I have PCOS. My OBGYN says to keep trying. When is a good time to ask for help? Today. Make an appointment. What is the usual protocol COI uses for day 3 FET? There's no, not sure what that means. I mean, estrogen plus progesterone. Can someone do an ERA before their first transfer? Yes. Do you recommend DHEA? We already went through that. I don't. I had 16 eggs retrieved and only 2 made it to blast. What causes a chemical pregnancy? Nothing causes a chemical pregnancy. If that chemical pregnancy is a pregnancy that started and then stopped, which likely means that the embryo was not developing normal. I only had 1 mature egg and it didn't fertilize. Okay. Not sure what that's from. What's the issue with gallbladder surgery versus gallbladder emergency surgery? I don't know what that means. What are your thoughts about transferring low mosaic embryos, Carol and Michelle? Well, if it's the only embryos you have, I think it's worth a try. Your body is really smart, and if it's not going to work, it's not going to work. But if it does work, it may well be a normal embryo. So yeah. Tried to get an appointment. Earliest is November. I thought it was December, our appointment. So November sounds like it's closing up a little bit. But yes, we get 80,000 requests for care a month, 8,000 phone calls a day. So, yep, it is harder to get appointments, I'll be honest with you. Like I said, we've gone from 8 staff members to 40 in less than a year. We hired 1 doctor, 1 nurse practitioner, and we're looking at another doctor. And we're trying to find doctors. They don't exist. So if anybody has a reproductive endocrinologist who wants a job, we'll take it. What is PRP and who do you recommend get this service? Dr. Radisha Brown. Well, PRP is platelet-rich plasma from your own platelets have growth factors, angiogenic factors, and so they help bring blood flow and to the organs. And so if you have low ovarian reserve, that might be a person that might help, or a very thin lining, you can actually put PRP inside the uterus. Is it okay to take fish oil, CoQ10, vitamin D, and prenatals? Yes. How long should I wait to do another end of egg retrieval after getting all abnormal embryos? Don't wait, Happy, because every single month your body's losing anywhere between 1,000 and 10,000 eggs, so you kind of don't want to wait. Do you have a list of places where we can do ultrasounds? If yes, absolutely. Look on our website under partner clinics, or call the Global Travel Group. Yes, we have 300 partner clinics around the country. So we're there to, and we'll take on more. Anybody who has an OBGYN that you really like, and they seem to like fertility, please reach out to us and get us their names, because they can become partners with us. We will teach them how to do a lot of stuff that will make them a better doc, a bigger practice, more profit. I mean, we want to help them. I have diminished ovarian reserve and have done 2 IVF cycles, got 1 egg out of doing both IVF cycles, and 1 egg didn't fertilize. What would be the best option? Nita is donor egg. So that would be your best option there. Okay. And anyone who requests a video, we don't do video things if you're requesting to get on video. Why are intralipids recommended in medication regimen? It's to lower inflammation. It's like being on a low carb, moderate protein, high fat diet, which is the ideal diet. And again, like metformin, it's a cheater's way, or a quicker way, I should say, more efficient way of not having to be a strict person on their diet. Can my OB/GYN do my IVF monitor? Absolutely, Heather. Get us their names. We're happy to teach them, happy to get them involved, happy to show them how to code, happy to teach them how to do IUIs. We're happy to do all that stuff. How to know egg quality was not good enough? How do you know the egg quality is not good enough? Well, you don't. There's no measure of egg quality. I will have hysteroscopy next week to remove a septum. Is it standard practice to check for endometriosis before embryo transfer? It's not standard practice, although it's a good idea. When do you start the serovital? Or I'm assuming that's what it is. Immediately. Is it possible to predict the number of eggs you retrieve based on AMH, or just based on response to medication? Kind of AMH and age is your first numbers. All medicated embryo transfers have failed. I try to modify natural with intralipids. What should I try next? Well, I'm hoping you're doing acupuncture, hoping you're doing growth hormone, hoping you did PRP washes of the uterus, hoping you did HCG washes of the uterus. I'm hoping you've ruled out endometriosis. I'm hoping you're doing the keto diet. Those are some of the things. All right. Oh, well, your embryos are untested, Lee. There's nothing. If your embryos are untested, that's the #1 reason they don't stick, so you can get them tested if you have any left. I am 6 weeks, 3 days today. I went for my weekly blood work and my TSH came back at 3. Should I be concerned? Tiny, not really at this stage. You should be fine. Hello, Shanta. Is the number of eggs retrieved predicted by estradiol level check on retrieval day? No, it's by follicle count. And how am I, Shanta? I'm doing well. Thank you. My voice is a little bad. I have Kelly, I have endo. I'm 44, do acupuncture, great. Keto, PRP, labs, ERA, all done. I have prime with HGH, LDN, estrase, and progesterone, fish oil, prenatals. Am I missing anything? Said you were keto. Wow, Kelly, I'm very proud of you. You're doing everything. You can pick up some Serovital at Costco or online, Serovital, and that might help a little bit. And if anybody smokes around you, get them away from you, including your partner. Should I space out my HCG from my hysteroscope and laparoscopes? No. My current doctor said I have too many follicles, which causes irregular cycles, and diagnosed with PCOS and gave me metformin. I would prefer an alternative. Oh, okay. Well, unique. Well, an alternative is low carb, even keto eating, myo-inositol or inositol, acupuncture. Yeah, those are the key ones. I have an endometrioma. Does that mean I have endometriosis? Absolutely. An endometrioma is endometriosis inside the ovary. So that's all it is. Should I space out my... Oh, I already answered that. Okay, got a kiss. Thank you for the kiss. Thank you. All right, you guys are wearing down? Oh, bunches of kisses. Thank you. And also saw not helping to get regular cycle. How to get regular cycles back. Infertile me. Well, it depends on the reason why you have irregular cycles. Certainly, lowering weight, body weight can help with, I don't know what your weight is, of course, but that's one thing that helps getting you back to normal cycles. Low carb eating. Yeah, those are the main ones. Oh, I got all kinds of kisses. If my endometrial biopsy came back normal, but my lining is thick, what do I need to take? Well, there's no such, if your endometrial biopsy, your ERA came back, you said normal, endometrial biopsy. I'm assuming that's the endometrial receptive. Oh, I see, it's thick. And they were worried about cancer. That's what they were worried about. And it wasn't cancer, which is great. So you have to make sure that you have enough progesterone to have a good bleed, Heather. And if you can't, then we can give you progesterone. Oh my God, JK Van L. Gellen. FET is Friday. Friday seems like a lucky day to me. So I'm excited. Hello, good evening. Is it worth seeking fertility help at age 40? Rosala Rosario. Absolutely, absolutely. All righty. 44, not making enough eggs at this point. Fibroid history. Will I need donor eggs only as the fertility clinic says? You may need, thanks for the kisses, you may need it, but and not making enough eggs. Okay, well, Shanta, every month you have fewer eggs. So what clinic am I at? Well, I'm Dr. Magarelli. I never say, oh, there I am down there, CNY, Colorado. In the Colorado clinic, we serve half the country, and everything west of the Mississippi pretty much comes to us, although we get a lot of people from Florida too. And then we are opening up our Florida clinic, should be opening up for monitoring in about a month. Next year sometime, it'll be hopefully open for retrievals. Audriana, can you explain what happens during an endometriosis biopsy? Well, an endometrial biopsy is a biopsy of the uterus, which is simply a little straw we put inside the uterus. An endometriosis biopsy is something that happens during surgery when you're asleep. Audriana, I have one this month as a shot in the dark, and I'm a bit nervous about. Oh yeah, it's going to be a little bit of cramping. You should be fine. What does the genetic testing tell you? On the embryo, it tells you all the chromosomes, all 23 pairs. It tells you whether it's a boy or a girl. So that's what the genetic testing does. So JK Van L. Gellen, you want a girl? Just simply keep getting more embryos. Absolutely. I understand. Okay. First fresh cycle ended in ectopic, then FET failed. Am I okay to skip Neupogen? That was added for me. Yes, of course it is. You can skip it, Samantha. Absolutely. I don't want you ever to think that the extras or the add-ons or the supplements are the key. They're not the key to your fertility care. They may be a little bit of help, but they're not the key. Of course. I have 5 3-day left, 2 7-cell. Oh God, I have 8 eggs. Okay, should I do another retrieval away from my lap? Oh my God, I'm not quite sure what your question is. Oh, Miss Puffer, I have 5 3-day left, 2 7-cell. The rest are 2 and 3 cell. Okay, I have 8 eggs, 8 fertilized, 8 got frozen. Wow. Should I do another retrieval while I wait for my lap, or wait? I just turned 35, AMH of 1.1. Well, you know, Caitlin, it depends on how many babies you want. You figure 2 chromosomally normal embryos will make 3 chromosomally normal embryos will give you about an 80 to 90% chance of 1 baby. So that's 3 chromosomally normal embryos. So you can do the math from there. At 44, they make it seem as if donor egg is the only choice. Of course, it's not the only choice. You can try using your Shanta, of course, and we're happy to do that. Samantha, it's my pleasure. Caitlin, it's my pleasure. Is there a test available at CNY after conception that tests for different types of syndromes and other issues? No. Not after conception. That would be done by your OBGYN. It's much cheaper on the garage sale group. Oh, I don't know what that is. Sorry. Much cheaper on the garage sale group. I think you're on the Amber. I think Vance, you're in the wrong group there for garage sales. When can I transfer frozen embryos after a C-section? 18 months, right? Because you're breastfeeding, getting and healing. So 12 to 18 months. I'm assuming you're breastfeeding. Talking to Samantha. Amber, you're funny. That's so funny. Well, just talk. That's fine. Okay. You said not to wait to do another egg retrieval, but don't I need to do acupuncture and take steroid vital to prep my body? Yes. But that should be happening the day you found out about it. So start doing it, but you don't wait. Start doing it, but don't wait. I know that's. Is there a cheaper alternative to Omnitrope? Well, Serovital is a growth hormone secretagogue that comes from your own body, so I would say that's cheaper. Oh, good, Kelly. It's my pleasure. All righty. Can I use my own egg at 41? I have regular periods and ovulate. That's Iuis, me kitty. Iuis, me kitty. Yes, absolutely. Happy, my pleasure. I'm having irregular periods since having a miscarriage, and I'm having a hard time trying to figure out when I'm ovulating. Are these ovulation tests accurate? Not really. You should get ultrasounds, go to the clinic, go to ultrasounds, watch the follicles grow. There also may be some things going on inside the uterus that's causing the bleeding, which you're calling periods. So I would definitely do that. Hola, buenas tardes, doctor. ¿Tiene clínica en California? No. Lo siento. No hay una clínica en California. Okay. I have 2 frozen blasts. I'm 32. Should I try to bank eggs, bank embryos? Yes. Yes. If you want more than 1 child. And you guys, okay, there we go. That's where you can get a coupon for Omnitrope, everybody. Get a coupon. What exactly is the FSH and baseline consist of? An ultrasound and blood work. And that's what it is. They do an ultrasound and blood work to tell us where you are in your cycle, and that helps us figure it out. My husband is currently going through radiation treatment, for stage 3 cancer. How long does he need to wait in order for us to proceed with IVF? Again, we'll get his sperm frozen today. 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 That's not a repeat. Get his sperm frozen. That's what you need to do. I get 3 to 4 mature eggs to get sperm. I get 3 to 4 eggs each month. Why am I not getting pregnant naturally? I don't know how you know you're getting eggs each month. If you have a follicle, does not mean an egg. Is there a difference between HSG and saline sonogram? Absolutely. One will tell you about your fallopian tubes. The other is a really sort of close to a hysteroscope, tell you about your uterus. The HSG will tell you about your fallopian tubes. The saline sonogram is much better for the eye to see subtle differences inside the uterus, better than the HSG. Is there anything we can do to increase eggs, making it to blast? Well, a healthy egg is a healthy blast, right? So anything you could do to make yourself healthy body, fertile body, download our family building guide. Okay. If doing reciprocal IVF and the egg provider has endometriosis, does that affect the success rate? Yes. Should I stick my eggs since my AMH is 1.7? Well, no, the age trumps the endometriosis diagnosis on that, Brandy. What's the difference between banking embryos and having 2 retrievals? Nothing. How long after an unsuccessful transfer can I do another? Next month? What's the difference? Oh, okay. Thoughts on FemView? Well, I mean, many people use it for a pseudo view of the fallopian tubes. I know people use it. I've not seen any studies comparing it to HSGs, though. Clobid or Femara for PCOS patients? Femara, letrozole. I'm 37 with diminished reserve and have 3 follicles this cycle. Do you recommend IUI or IVF? 37, 3 follicles. Get the eggs out, make babies. IUI is about a 1% chance. IVF will be about a 15% chance, 15 times better. Should I just go to IVF instead of time baby dance? Don't know what that is. Okay, my pleasure, Doula Carolina. What are the chances of successful IU at 43? Less than 1%. Samantha, no, okay. Would I be able to use birth control prior to a cycle to help me retrieval by doing a more specific time frame? My last clinic did this with all patients, cannot hinder success. It doesn't necessarily hinder success, no. Ren, Christopher, 44, 2 embryos were dividing exactly how it should at day 3. Today is day 4, and both embryos have 8 cells, not morula, and they are still watching it and hoping it still divides. What do I think? That's great. It's still developing, a little slow, but definitely potential baby makers. Supreme, I did 2 rounds of IUI, and now my doctor told me I have cysts on my ovaries. Yes. Is it from the meds? Yes. And they'll go away. Yes. Would you recommend IVF priming with estrogen for 42-year-olds? Yes, absolutely. Absolutely. You guys getting tired on the Facebook side or the YouTube? Here we go. Why is birth control pills used before retrievals? That's to make the schedule better for the doctor to do the retrieval. It has nothing to do with your biology. BRESAP. I'm starting my meds today for FET using my last 2 embryos. I got back on Monday from monitoring. Hopefully we'll schedule a transfer with you in Colorado around Labor Day. My concern is my LH seems to rise pretty quickly, and with the holiday weekend, I worry that I'll ovulate before I can have an FET since no transfers are done on Saturdays. And then Monday, no transfers are done on Saturdays. Okay, and then Monday will be a holiday. We'll be working Monday. Don't worry about it. We'll be working Monday. Would you recommend IVF priming with estrogen? Yes, JJ. For a fertile woman of 32 years old with tubal ligation, would you recommend tubal reversal? No. Do embryologists at CO call patients? Absolutely not. Absolutely not. What's the limit for diabetes A1C for egg retrieval? There's no real limit, Janine, but we do want it around 6 or below. How many rounds of IUI do you recommend before considering IUI? What? Oh, IVF, I mean. Oh, you're 39? I would go straight to IVF. Yes. Can a complex cyst affect successful transfer and implantation? If it's hormonally active, yes. Whew. Thank you, Dr. Mag. All right, I don't know what I did. Okay, will retrievals happen on Thanksgiving? No, will retrievals? I have no idea, Nicole. No idea. What's a good AMH number, Yandra? 28. If you're 28 years old, it should be about 3. Are you closed for a long time during holidays? Probably not closed. We're probably not closed. I think we try to close on Christmas Day and New Year and Thanksgiving Day, I think, but I don't know. It doesn't matter. We'll figure it out. What's an alternative to thickening my lining if high estrogen didn't work? Acupuncture. PRP is an option. HCG washes is an option. PRP better than HCG washes. How long after consultation can we do IVF with donor eggs? No idea. Depends on a lot of factors. Usually within 6 to 8 weeks. How many untested embryos do you recommend transferring? 1. What is a good AMH for a 38-year-old above 1.5? Males by 2T, okay. What's a good AMH for a woman, 34? 3. But again, you know, these are depending on the laboratory that you're working at because they kind of differ. So let me talk about, I think I'm going to be moving my Facebook Lives to 4 p.m. my time, which is 6 p.m. rather than 4:30. I'm going to work on moving that hopefully next week. So I'm going to be starting a half an hour earlier. It's a scheduling thing. So I'm hoping to start at 4 rather than 4:30 on Tuesdays. That should, we still have an hour, and we'll see how that goes. And then we're also planning on adding possibly another doc to the list of doctors that will do these Facebook Lives. So I think there's 8 a week. So we're going to be probably adding more doctors. What else is happening? Well, we're now interviewing a reproductive endocrinologist, so we'll see how that goes to further increase. And we're looking at the Denver market for expanding into a satellite, at least monitoring in Denver. That's something we're looking at very, very well. Wrangle Dr. Fink, of course I will, Amber. That's, you know, I'm going to do that. I'll definitely wrangle him. So that's the future there. You know, Dr. Fink is doing fantastic. I mean, he's taking the bulk of the retrievals and the transfers, getting him way up to speed. Amazing, amazing guy, a good thinker, great doc. My gosh, my team is from everybody from the front desk to the lab, the on-call team, the nurse call team, the global travel team, the financial team. You know, these are just wonderful people working their best to help. There's a fertility support group that Vanessa is advertising there on Facebook. Vanessa, why don't you advertise it on Instagram if you have an Instagram account? Like, copy that over to the Instagram. Thank you, Amber. Thank you, Caitlin, Miss Puffer. Atlanta location, it's not going to be for quite a bit of a while, probably next year. But again, we don't know when the Atlanta location is going to do retrievals. We're really happy about our growth. It's remarkable. We're very blessed by all of you and all your faith in us. And please understand we're working the hardest we can. And I know sometimes it's difficult to get a hold of us, or the personalized care, it really comes from the whole family, but not from a specific person. So we have a very deep ingrained CNY philosophy, and that's how we give you the personal care. The nice thing is the EMR is fantastic for recording information, as well as the portal messages. Please make sure you put your information in the portal messages so we can read those too. Anyway, so next week is the second part on endometriosis. So tell everybody next week is part 2 of a 3-part story on endometriosis. We don't turn anyone away. That's true, Kelly. And we take care of anyone, no matter what age, no matter what AMH, no matter what someone has said you can or cannot do. We're going to be there to help you. And we're very proud of that. But it does cause some problems with communication. There's no doubt about it. So next week, we're going to start at 4 o'clock Mountain Time. We're going to be doing endometriosis part 2, which is of a 3-part story. It's developing, it's exciting, and a lot of people appreciated it. And then I hope you have a wonderful week. Thank you for spending your time with me. I wish you all the best because you are the best. And thank you. All righty. Yeah, a pharmacist. Don't need a pharmacist quite yet, Janine, but thank you. Thank you, guys. I'll say bye. Bye.